I cannot remember the last time, if ever, that we've talked about this subject on the program. I think we have, but it's been a long time ago. It's probably at the beginning of when you were hearing about bariatric surgery. We have from the University of Missouri Healthcare, Dr. Andrew Wheeler, who is here, and his specialty is bariatric surgery. It's good to meet you. How are you today?
Doing well. Thanks for having me.
Let's give a broad definition of what is bariatric surgery.
So bariatric surgery is simply an operation that modifies the GI system in some way to help a person lose weight.
The first ways of doing that was what? What was the original bariatric surgery?
Well, there's been a lot of very old historic things that are no longer done. Originally, it was procedures that modified the intestines in some way so people didn't absorb things, and over time that has progressed. But the main operation that's been around the longest is the gastric bypass.
So what was the banding surgery?
Yeah, so the lat band, or the laparoscopic gastric band, which was done in the early 1990s is when it started, and it's now fallen out of favor quite a bit. But it's an artificial inflatable device that goes around the upper portion of the stomach to help restrict how much a person can eat.
All right, I just wanted to get that out of the way because that's not done anymore. Not very often.
Not very often.
So what have we moved to again? Go ahead and let's introduce us to what's happening now.
Yeah, so we have really three main procedures, but the field is always evolving with less invasive and other ways. But the three main procedures that we do, number one is kind of what we call the gold standard, the gastric bypass. It's the most effective. It's been around the longest.
And what is that?
That's where we create a small pouch in the stomach that holds about 1 to 2 ounces, and we alter the intestines very slightly to allow for passage of food and bypass the intestines. And one of the most remarkable things is it's an excellent procedure for taking away a person's diabetes.
Oh, I see. And how often is this used? Is this a common practice now, or is it in rare cases?
No, in the United States, the gastric bypass is done, depending on the center, anywhere from 50 to 70% of people have a gastric bypass who have weight loss surgery. And weight loss surgery is done about 300,000 times in the United States every year.
Not everybody who's overweight would be a candidate, or would a doctor suggest needs to have weight loss surgery. Would that be true?
Oh, absolutely, sure.
So where do you make that decision? What's the decision where you say, okay, for a person's health and long-term prognosis, this would be the best route to go?
Yeah, so generally people that are going to benefit from weight loss surgery, first of all, is people who have been struggled with their weight for years and have had unsuccessful attempts with diet and exercise. The person that just gained 50 pounds for whatever reason in a year, we're not going to rush to weight loss surgery. Second, they have to be an appropriate medical candidate. We can operate on some very high-risk people in terms of a lot of medical conditions, and a lot of times take away those medical conditions that are limiting their life. But we take them through a very diligent process to make sure they're not too high risk. And then finally, we consider it someone who's about 100 pounds over their ideal body weight, a BMI of 40, or a BMI of 35 if you have one of those medical conditions that's affecting your health that's associated with your obesity.
We're talking about bariatric surgery with Dr. Andrew Wheeler. I interrupted you when you were talking about there are three types of surgeries that are commonly done now. You mentioned a gastric bypass. What's after that?
The other two, and actually the one that's most commonly done in the United States now, is the sleeve gastrectomy, and that's where we just take out about 80% of the outer portion of the stomach, and it helps control what a person eats. It also helps control their hunger. And then finally, we have something called the duodenal switch, which is a combination of the sleeve, which is restrictive, and it's a very malabsorptive procedure. So it's very, very effective, but it does have more risks or side effects.
So these are fairly recent developments, but as you said, research is ongoing?
Correct. The gastric bypass has been around since the late 60s.
Yeah.
The sleeve's been around since, and the duodenal switch for probably about 15 to 18 years now. But all the time there's new things. So there's a balloon that you can insert into the stomach that's temporary. It helps control people's hunger. There's endoscopic, or using a scope to go down and change and modify the stomach to help a person lose weight. And, they continue to evolve all the time.
When you do this kind of surgery on someone, what do you tell the person who now has this surgery? What do they need to do to change? Is it something they have to, obviously, I guess that they don't eat as much after that? They don't feel like they need as much? What do you tell them to expect?
Yeah. So first, at the university, we believe this is a comprehensive program. This is not just a come in, pay your money, get your operation, and go on down your way. We enter into a relationship with these people really for life, with the goal of helping them make behavioral changes, We have an on-staff dietitian to help them make the appropriate dietary choices. We have a medical weight loss physician that will continue to work with them before and after surgery. But it's a truly a comprehensive, holistic approach to helping a person lose weight, because the procedure itself is not going to just make a person lose weight. It's a tool, but it's a tool the person has to use.
That's interesting. I'm glad you said that, because I think a lot of people would see it, well, this is my secret. This is going to be the miracle that I've been looking for.
Correct. And it's, some people will accuse my patients of, oh, this is the easy way out. And I think most of my patients would say this is not the easy way out. It's a committed way, and it's someone who's committed to their health. The remarkable thing, though, is the tremendous health benefits that weight loss surgery has is second to none. There's nothing else that can take away diabetes out there besides weight loss surgery.
When you say take away diabetes, I need to come back to that. What does that really mean? Is it type 1, type 2? What kind of diabetes are you talking about?
So mainly type 2. Type 1 is a different beast. But on the other hand, even people with type 1 diabetes will have drastic improvement in the amount of insulin they need. But with type 2 diabetes, we know that 100% of people will have improvement in their diabetes. With the gastric bypass, in a well-controlled diabetic that's had it for less than 5 to 10 years, the rates of we'll say remission, and I like to use the word cure, but the rates of remission, meaning they're off medications, their sugars are good, can be as high as 70 to 90%. Even people who have been on sometimes 50, 100 units of insulin a day, which is a tremendous amount of insulin, can go down to the point where they're off all of their insulin and maybe on, just a medication.
So what do you say, as I wrap this up, what do you say to people who are listening to this and say, I wonder if this is something I should look at. I wonder if it's something that so-and-so might be a candidate for.
Yeah, I would encourage people who have struggled with their weight for years, and there's a lot of people out there who, especially if you've started to develop medical conditions or you have a family history of medical conditions and you're concerned about potentially developing those, that it's worth a look. It's worth looking at, can I do something that has a good recovery, has a very low complication rate that can lead to a lifetime of benefits of improved health.
Do you start with your family physician, your primary caregiver?
You can, or you can go to our website and start the process there as well.
And what is that website?
That's if you go to muhealth.org, and then I think it's weight loss.
Okay.
Or if you just search University of Missouri weight loss surgery, you'll get to us.
And I know if you go to muhealth.org, they have a search box there. You could put bariatric surgery or weight loss surgery.
Absolutely.
Dr. Wheeler, thank you. I appreciate your time
Thanks
today.
for having me this morning.
Andrew Wheeler has been our guest. It's News Talk 1400 KFRU.